starting a new journey of success with the part 3 MRCOG. So very important to understand what is the type or the nature of this exam, what the assessment in the exam is all about, and how is your study plan, okay? So first of all, this is an oral exam, right? So maybe some of you have seen this before. Maybe this is the first time to see it. This is the circuit of your exam, okay? So this is the exam stations. Your exam consists of 14 stations, my friends, and we call it a circuit. Why it's a circuit? Because simply every one of the candidates will start at some station at some point, and they will keep on moving, okay, or shifting to the next task and so on until they completed the 14 tasks. So, for example, the person who started here at the station number 5, okay, they will have to go 5, 6, 7, and so on until they reach number 4, right? So they completed their circuit. The exam time, okay, is exactly maybe around 168 minutes, something like that. So it's not a very long exam, okay? It's not like the part 2, for example, you have 6 hours of, squeezing your brain to get the answers and all. No, this is like, a short exam. Each station consists of 10 minutes. Okay, so you have 10 minutes to prove yourself and to pass the station. Then you will have 2 minutes, okay, after you hear a bell, you will move, okay, and stand in front of this one. Okay, what is this? This one, okay, where you will find the station written in your exam, okay? So the task, next task, any investigation related to the task, any, for example, notes, okay, of that person or this patient, okay? This will be written here, okay? And you have to read it in 2 minutes. Then you will hear another bell ring and you will go to the inside the cubicle. Okay, so this is the inside of the cubicle where you will be sitting. Of course, the exam day will be like, very similar to your oral exams in the medical school, right? However, you will be much stressed for some reason, okay? This is the end exam, okay, for our career. So I know that a lot of you, they, mashallah, they go for other certificates after the MRCOG, but nothing like the MRCOG. Okay, so the MRCOG is the top, of our career, top exams of our career. So you have now the part 3, which is the, the final destination before you become a honorable member of the Royal College. So dear friends, this is a cubicle and this is the exam sitting. So let's see, okay, what is the resources to study, okay? So I'll tell you, the question number 1, shall I read the guidelines again? The answer is no. You don't need to read the guidelines again, okay? As much as your knowledge is fresh, okay, you remember the guidelines, so you don't need much of reading or revision. You will go only to the guideline if there is some part that you want to remind yourself of. Otherwise, I don't recommend reading at all, okay, for the guideline from the scratch. No, it's just, to remind yourself by some points, and that's it. Okay, so for the theory notes, you don't need them too much. It just, as I told you, in the cases as a backup, in case if you forget something and you want to read it, like quickly, remind yourself by only this point, only one point. You forgot the point, to go to this one, okay? But don't read the whole guideline. This is much waste of time. Okay, so the theory notes is this there, okay, for the revision. So yeah, you can still have the access in the website for the theory notes. So this is one thing. Another thing, there is a strategy cases. Strategy cases is similar to the exam, okay, ideas, right? So it will be also formulated, you know, in between the cases that you have, okay? But is it the most important one? Not the most important one yet. Okay, so how about the practice book? Is the practice book cases important? Yes, it's very important. Very, very, very important. Okay, so one of the top important things that you need to do and start with is the books, the practice books. Why? I'll tell you. In the part 3, we have 3 to 4 books, okay, that is recommended for, yeah, up to 5 books, one old book, okay, but still useful. Okay, so this is a Tony book. So we have Dr. Lisa book, number 1, which is the smallest one, but it's very useful. Then we have the Get Through book. This is for Dr. Justin Shu and Dr. Ari from Birmingham Women Hospital. And then we have Dr. Kunji book. No, third important one is the Oxford book. And the Oxford book is a book for the trainees in the UK. So it have, you know, a very important, you know, collection of cases. It's more than 100 cases. And it's very important. Most of these cases used already in the exam. So it's like, you know, you are practicing book and recall in the same time. So it's very useful. Then we come to the Dr. Kunji book, which is have circuits in it, okay? So you can practice at the end, or you can test yourself with your study partner, okay, at the end of your preparation. All the books, as I told you, like Dr. Tony book, you can go for it, okay, as again, for the practice, because it have around 4 circuits as well. Okay, so but it's in the old style. So now you start with Lisa and Oxford, okay? Then Get Through and Kunji, and last thing is Tony. So this is the books of the practice, and very important, written by examiners and already have been used in the exam before. Most of the cases appeared already and still appearing again. Okay, so books are really important in the preparation of the part 3. Okay, this is the first recommended source. Second source is the recalls. Okay, are the recalls important? Yes, important. How much is important the recalls in the part 3 exam? I'll tell you. Some of you already know me from the part 2, and you're aware that I'm not that person who focus on the recalls for the theory. And we discuss, you know, the base knowledge, okay, and the concept, and then last thing we can go through the recalls, you know, to know about the exam ideas. It's useful, okay, in the part 2, but in the part 3, it's mandatory. Okay, it's vital. You can't do part 3 without recalls. That's it. Okay, so that's why all the course, okay, is based on recalls. So we practice recall, and recalls are very important. Why it's very important? I'll tell you. Some of the cases that appear in the exam, in the part 3 exam already, that came from topics that is not very familiar in part 2. So even if you studied all the knowledge of the part 2 one time again, which is not recommended, as I told you at the beginning, but you are sure you covered everything, you will be surprised in the part 3 exam with some task that is away, okay, from the theory that you have practiced or you have prepared. Some rare also conditions are there. So some tricky situations, because they are assessing something else than the theory. Okay, so for example, okay, there is one recall case that's famous about a fetus that is affected by echogenic bowel. Okay, one recall case is about a fetus that have talibus. One recall case is about a lady who have Charcot-Marie-Tooth syndrome. Okay, one of the cases is about, for example, a case who got, you know, some maybe rare disease, and she comes to you to discuss it, domestic violence, for example. So it's not about the theory anymore. It's about the topics of practice where the examiner find that it's best to assess the domains, okay, of the Part 3. Other resources that's recommended than the practice books and recalls is, for example, the UK circuit cases, okay, which is also be covered during the revision mocks, okay, so it's a good source to revise. However, not that much important as I told you, first books, then recalls. We have notes, of course, for the Part 3. However, the notes is not the main source of the study, as I told you, because we teach you in that Part 3 how to present yourself, how to prepare yourself, how to deal with the tricky situations in the exam, okay, how to discuss with the examiners, okay. So it's not about to give you a script, okay, for the Part 3 answers, okay, because it doesn't go this way, okay. You are face to face to the examiners, okay, and they are very smart and they know who is a pre-scripted person, okay, and who is the person who have a good concept and the clear logic, you know. So you have to show this to the examiners. Okay, so let's see how is the nature of the tasks that you have, right? So the tasks that you have is either a simulated patient task, okay, or a structured discussion task. What is a simulated patient and what is a structured discussion? Simulated patient, this is a task where you are sitting there in front of a patient and the patient is acting. She's a role player, acting as a patient in clinic or in the hospital or whatever the setting, okay, and she's asking you questions, and she have some concerns or she have some problem, and you are there to help her manage this problem and explain it to her in simple language, not in a medical terms. Okay, so the simulated patient task is the majority of the exam, and you will have at least 9 tasks. Okay, so you will have 9 to 10 tasks as simulated patient or a simulated colleague, okay? And you will have the setting like this. 1 second, okay. So this is an example, okay, of this one is an example of a simulated patient task. So this is a role player in the middle, okay? And this is a clinical examiner, okay, who is a doctor or an examiner in the RCOG and is assessing you, okay? And this is what's called the lay examiner. Do you know who is a lay examiner? A lay examiner is a person who is non-medical at all, okay? And he is attending the discussion or attending the exam to judge your approach to the patient, your communication and your safety, okay? And simply, let's say, he is or she is advocate for the community. We want this type of doctor here in the UK to practice the medicine and have patient or this person is not welcomed. Okay, so you will get some stations where you have a lay examiner sitting there, assess your progress. This is will be like in half of the role player station, can be 4 maybe, okay? 4 stations with the role player according to the availability of the exam, okay? So, and here is the candidate. This is the poor candidate in front of the people. Your communication or your dealing during the exam is only with the role player. You are discussing with the role player only, okay? You don't give any attention to the clinical examiner or to the lay examiner, okay? Don't say, hi, how are you? Or anything like this. You speak only to the patient and act as you are in the hospital. And I always say this is the exam runs in the RCOG hospital. It's an imaginary hospital, okay? And you have to act that you are on call for 3 hours in this hospital, okay? You are working for 3 hours in the RCOG hospital, and those cases waiting for you as it is for real, Okay, this is not an exam, an OSCE exam like others exam. Okay, this exam it depends on your acting skills. Okay, and how would you pretend that you are in the real situation, and your flexibility in communication. So you will act as you're seeing the patient, for example, in the fertility clinic, and you're discussing her concern. Then the next task is a patient who is in the delivery suite, and she's pushing for 2 hours, and the baby is passing meconium, and you want to explain to her that you have to expedite the delivery now, and you have to help her either by the assisted vaginal delivery or by the cesarean section, and you explain to her the difference between this and that. Okay, so this is the setting for the simulated patient exam, and you will be here at this candidate. Another tasks in the exam, which can be 4 to 5 tasks according again to that day. It's a structured discussion, and here you are in a direct here communication with the examiner. You are sitting in front of the examiners, no barriers, no third person attending, and you will introduce yourself as for real. Hello, this is me, Dr. Rabah, I'm Rabah, one of the exam candidate today. I have read my case and I'm ready for discussion. Then the examiner is going to discuss with you the case. It's like a case-based discussion, if you remember from the part 2. So he will ask you some questions about the case or about the topic, and you have to answer the question in a structured format. Okay? So this is simply. There is another task, a special task for this exam, which assess your teaching skills. Okay, so your teaching skills here is you are a senior or you are ST5 and you are meeting your ST1 or ST2, okay, who wants to help her in, for example, shoulder dystocia. She wanted to know how to manage a case of shoulder dystocia, or she wanted to know how to manage a case of kiwi, or she want to know how to manage a case of episiotomy, how to, to deal or repair episiotomy or a second-degree tear. So like this, okay? So the teaching task is one task in the exam, okay? And you are dealing with a colleague, so you are speaking with medical terms, no problem. So here, my friends, these are the types of tasks that you're waiting to see or you're expecting to find in the exam. Some of the countries, they have, for some reason, some political issues, they have online exam, okay? So in the last year, for example, they have one online exam. This is for people who have difficulty getting visa for traveling out their country, okay? And it was a good opportunity for the people, and but it was only for a special group of people who contacted the college, okay? So the online exam is the same thing, but you are sitting in front of a screen, okay? So you are doing everything as the real exam, but you're sitting in front of a screen, okay? So this is how about the part 3. About the assessment of the part 3, how are they going to assess you? And this is very important. If you know well how you are going to be assessed in the exam, so you will make sure that you fulfill the requirement in each task, right? Correct? So this is what's called a domains in the part 3. So in the part 3, there are 5 domains to be assessed. We have domain called patient safety, and from the name, this is concerned by the things that will make different in the patient life, okay? And you maintain the patient safety, right? Safety of health, safety of information, okay? So this is a very important, okay, domain. We have also communication with patient and the relatives, and the communication doctor-patient relationship, okay, is a very important module. And some people from overseas that they have never practiced in the UK, they have problem in applying the principles of communication with patients based on the UK practice and the GMC advice. So the communication with patient and their relatives, will be discussed in details by Dr. Amr Muhammad. He is the our mentor, okay, that will cover this part. Dr. Amr is a senior trainee in the UK, and he have a very good experience with the communication and teaching communication. So he will give you a special, advice for how to pass the communication module with the patient. Also, communication with colleagues. Colleagues means your juniors and your seniors and the other staff in the hospital. How are you going to make sure, okay, that you have a good communication with the colleague while you are planning the care of this case? This is, my friends, one of the domains. And it's a shame, to be honest. It's a shame that people fail in a communication with colleague, because they forgot the role of the seniors, they forgot the role of the MDT, they forgot the role of writing back to the GB or involving the GB in the care of this patient. So a patient with a chronic disease, let's say, okay, the patient with chronic disease, she had a doctor, a specialized doctor for this disease. Let's say she had a chronic asthma, okay, so she had a doctor for that. And she had the GB, who is a family physician, and he's the best person aware of her medical history, and he's the person in the primary care with the first contact with the patient all the time. And she had a midwife also, okay, in the GB area. So you need to have a communication. If you want to give a plan of management of asthma during pregnancy, for example, you have to involve those people in the plan, and you have to let them aware of what you have done. Let's say you changed medication, you give a specific advice or whatever, okay? They must be involved, right? If you forgot the role of involving the GB and her doctor and the midwife, and if there is a specialized nurse as well, okay, unfortunately, you miss a big portion of your station. Okay, so that's a very important part, okay, guys, to make sure of it. Information gathering is a very important module, and for some reason, people overdo the information gathering in the exam, which is I don't really understand what is the problem that makes this attitude. The information gathering doesn't mean history taking alone. Information gathering starts from reading the task carefully, highlighting the most important point in the task, understanding the situation correctly. If there is investigation and let's say image report or biopsy report or anything, your understanding of this report and using this in the management, this is you are gaining information from history, examination, and investigations. Okay, so it's not only about history taking, right? So history taking is part under of the information gathering. Applied clinical knowledge, and this is very important, they assess if you have a safe plan of management or not, right? So those are the 5 domains that will be tested in this exam. And when you receive the result, inshallah, okay, they will tell you that you have passed, okay, the exam, and you scored, for example, 67, okay, and the pass mark was 61, okay, which is an average result for the candidate. So they will tell you that in a table, in a special table, that you have passed for the information gathering, reached the standard. For patient safety, reached the standard. Communication with colleague, reached the standard. Communication with patient, reached the standard. Sometimes, for example, they applied clinical knowledge, did not reach the standard. The question here, can I miss a module or fail in a module but pass the exam? What do you think? What do you think, guys? Testing your background knowledge of this exam. Can I miss 1 or 2 modules, however I pass the exam? Yes, you can. Okay, so you can. Yeah, it's fine. You can, okay? As long as your total mark passed the score, okay, it's fine. But, okay, when people got a result with 4 domains not reaching the standard, this is a serious issue, and most likely those people don't pass, okay? But what I have seen from the results before, okay, that 1 module, it's okay. 2 modules sometimes can pass, provided that they have done a very good job in the other module. But it's risky. Why? Okay, there is some principles, okay, in our practice that we want to cover it and want to make sure that it's covered very well to secure the domains in the exam, okay? So how are you going to prepare yourself? You are going to prepare yourself, preparing the case, reading about the case, source of reading, I will explain to you, okay? And then you will start, to answer the questions, okay, of the role player while you are giving a plan of management, okay, to the patient, and they explain to the patient a plan of management. You have to touch some points, those points, to ensure that you have covered your domains correctly, okay? So this is like a tips, okay, on how to secure the modules. If you are aware of that, if you are aware of the modules and how to secure it, okay, in one task, that will be very good for you, and this will be a good practice, okay? Even if you open one book with me, for example, I will show you now, during the solving the case, and you're reading the feedback or reading the, solving the key of the case, you will find that it's divided into modules, okay? Domains, sorry, 1, 2, 3, 4, 5 domains. How have you covered the domains in this task? Some task in the exam, they will tell you in this task, this is a simulation patient task, cover the following domains. And you will find it cover 4 domains. Would it make a difference to you? No, it's not making a difference. Okay, so you just, you just, guys, make sure, okay, that, if guys, please, if you don't want to interrupt the session, please check your mics are muted. Thank you very much. Okay, so let's have an idea about domains to cover and the marking, okay? How the marking is done in the exam. So again, we said the domains: information gathering, communication with patient, communication with colleagues, patient safety, and applied clinical knowledge. So in each domains, there are some points that you have to secure, okay? Because in the exam, if you didn't secure those points in the domains, you failed the domain, right? So the patient safety domain, which is the most important one, okay? And it's the one that have the highest mark in each station, okay? So it's like, this is a vital one, okay? You have to make sure patient safety is fulfilled in every task, okay? So you have to be a safe doctor and pass the patient safety. Otherwise, they don't want your applied clinical knowledge in the UK, okay? Part of the patient safety, for example, okay, is to make sure when you're reading investigation for a patient, for example, okay, that this patient is the same person, okay? You don't want to tell some person, for example, that you have a cancer and she's not the same, right? So making sure or confirming the patient identity and the date of birth and match it with the person sitting in front of you is a patient safety. That's for example. If you are performing, for example, a procedure, and after you finish the procedure, okay, you didn't label, okay, the histopathology sample, the specimen, you think that this is something that's minor or this is a big problem. If you didn't have, you know, the patient ID and date of birth on the specimen, this is a major problem, right? So this is a patient safety. So patient safety can be in the cases where you have a structured discussion or you have a role play station. Can you imagine? So yes, it's not only about having a patient and you speaking to the patient and you confirming the patient information, for example, or covering the patient safety. No, it's also in the structured discussion while you are discussing with your colleague, okay, about with the examiner about the cases, right, and about how are you going to handle the case. So if you didn't mention the point of safety, you fill in this domain, okay? So now, for example, okay, also knowing your limitation, like this is a case that needs senior input. This is the case need consultant input, for example, okay? You can't really manage the case yourself. Even if you are a consultant in your workplace, in your country, even if you are practicing this case every day and you're managing the case all by yourself, you have to know the limitation of this ST5 in the UK, right? And you have to involve the consultant for safety, correct? So if you forgot involving the consultant, what do you think about the safety? Bye-bye, you lost it, right? If, for example, you have a suspect ureteric injury and you didn't call the urologist, you think that you compromised the patient safety? Yes, you did. Okay, so things like this is very important. Another thing also for the patient safety, as I told you, it's about the patient safety, not only the physical safety, emotional safety, and also the confidentiality, okay? The patient also sharing information. So, for example, you have a patient and this patient, for some reason, she's 15 years old, okay? And she comes to you asking for termination of pregnancy. And you missed asking her about the partner. Who is the person, okay? And it appeared to be afterwards that this is what her coach, okay, or her teacher, and he made an illegal relation with her. You forgot this. You forget asking. You think you compromise the patient safety? Yes, this is a big part. Yes, it's a big problem. Okay? So you have compromised the patient safety in this situation. Why? Because if there is a patient who is minor, a child, and she had a relationship with some person with different of age, 4 years or more, or this person have authority on her, like a teacher or somebody from the family, uncle, for example, or grandfather or whatever, okay? And this person is having a relationship with her, this relationship is illegal, right? And who is going to be asked about this relationship is the adult who had a relationship with a minor, right? Maybe he is using her, maybe he is abusing her, right? So if you didn't check this point, you failed the safety here. You have the point of, for example, you didn't inform the police about a case of FGM. You think you affect the patient safety? a minor had an FGM, do you think that you have affected the safety? Yes, you did, right? Yes, it's a part of the law. Yes, okay, so good. How about, okay, you have a patient, okay, who had, for example, sexually transmitted disease, and you forgot to tell her about the partner testing and notification. Is that compromising of the safety of the partner? He is a person, okay, and you have persons, okay, so yeah, you have to warn this person. Yeah, this is a problem, right? So this is the point, that if you forget it in the case, according to each case, okay, you fail the safety module. And if you fail the safety module, okay, thank you very much. That's enough for the task, okay? Nobody is going to help you, okay, to pass. The examiners sometimes are very kind. Most of the time, to be honest, they are trying to help you pass. But when they find a candidate who is not safe, okay, they don't, show any empathy to this candidate. They don't, okay, let this candidate pass the exam, because it's all about the safety. You are unsafe. No, sorry, you are not welcomed. You are not welcomed in our college. So safety is very important. Take care of the safety point in each task, please. Okay, like for example, taking a patient to operation like myomectomy, hysterectomy, or whatever, the patient in the childbearing period, and you didn't have her UBT, you didn't check the UBT. What do you think? Is that an action of a safe doctor? No, not a safe doctor action. So this comes under the safety module, and this is very important, that you have to ensure prescribing medication, which is very, very common. Okay, prescribing medication without checking allergy. What do you think? This is considered as a minor point where many people forget, but in the exam, it's a major point in the marking sheet. Okay? So make sure even tiny minor points you don't miss when it comes to the safety. So everybody check their allergy, please. Okay? Because the patient, maybe she is a surgical patient, right? And she had latex allergy, and you didn't mention that in her notes, and you didn't ask her about her allergy. Oh my God, that's big, right? A patient who have a group B streptococcus, and you are speaking about, we will give you antibiotic when you come to the labor, and we are going to give you the penicillin every 4 hours, blah, blah, blah. Okay, and you found out that she have a severe allergy to penicillin. So you are affecting the patient's safety. You are affecting the patient life, the hospital safety, okay, and your license as well, okay? So they will not let you practice medicine in the UK like this, right, guys? So please, please take care of the safety point, okay? This is the most important module, as I told you, in the task. Other point of safety that you have to check, okay? So for example, if a patient is, you're sending patient home, okay, you have to make sure that there is somebody home to help her, okay? A patient with a query ectopic or pregnancy of unknown location, and you're sending this patient home, you have to make sure that where she lives, how many kilometer from the hospital, how many miles away from the hospital, if she had somebody to bring her to the hospital or not, okay? Because if not, okay, and she got rupture of the ectopic and acute bleeding, she will die, okay, without anybody taking care of her, right? She will not be able to reach to the hospital in the proper time. Nobody is going to provide her help. right? So that's very important that you make sure, okay, of the safety netting, providing the patient with a telephone number for emergencies, okay? That's also a safety netting. So the safety point, okay, in the management plan, you have to secure your net, okay, of the management. Checking, for example, a surgical patient for a blood group, okay? Rule out pregnancy before surgery, okay? Any procedure, you check that the patient have signed the consent, okay? If you are in a station, for example, and the doctor in the station, the examiner asking you about cystectomy, okay, which is ovarian cystectomy, which is, a very easy procedure for ST5 doctor. However, okay, while you are mentioning how to do the procedure, you forgot the WHO checklist. It's called surgical safety checklist. So thank you. You have, failed this module in this task, this domain in this task, sorry. Okay, so that's very important, my friends, okay, to make sure any contraindication of drug before you are prescribing it, any allergy before you proceed for the management of the cases. Those are basic things, okay, in the safety, in securing the safety, okay? So before prescribing medication, make sure ruling out allergy, rule out medical contraindication, rule out any drug interaction, okay? Like, for example, a patient who have a medication for epilepsy, enzyme inducer, and you are giving her COC, for example, okay? Or she comes with require emergency contraception and you give her the usual dose, okay, of Livonel, for example, okay? So it's wrong. So please take care of this point, okay? And mention any side effects or any precautions of treatment while you are describing this to the patient, okay? So this is how you will fulfill the safety. And as you can see, the safety module is a part of the clinical management as well, okay? So it can be the same point. It can come under the applied clinical knowledge and it can come up under the patient safety, okay? The clinical governance point also need to be fulfilled, and the clinical governance in practice, how to apply it. For example, you have a patient who had a complication during her surgery. So she needs a debrief, okay? Incident reporting, for example, okay? If there is some complication or something happened which should not happen, you have to, report it. The duty of candor, being completely honest, okay, with the patient about what has happened. Clear documentation. So this is something in the end of any station, okay, that you have to make sure it's covered. You have to cover especially in the complication station, you have to cover the debrief, documentation, DATEX, which is the incident reporting, and the duty of candor. We call it the 4Ds at the end of the station. Now we have the domain of communication with colleague. Before we discuss the communication with colleague, guys, do you have any question about the safety is not clear to you? Okay, thank you. Okay, so dear friends, with the communication with colleague domain, in your exam, as I told you, we have two types of colleagues. We have a colleague that is a senior colleague, and we have a junior colleague, right? And we have a frame of work, right? So you're not acting alone in the NHS, okay? You are acting as a member of organization. Nobody can manage the cases safely, okay, without a team. So, for example, you have a patient who comes to you by referral letter from her GP because she have heavy menstrual bleeding. not responding to treatment. The GP have tried to give her mefenamic acid, COCs, and it didn't work, so he sent it you to the gynecology clinic. Right. Okay, so while you are discussing the plan of management with the patient, okay, you have to tell her about the next step in the management. If you want to arrange in specific investigation, for example, you have to arrange for her not responding to treatment like hysteroscopy and biopsy, okay, and so on, okay? There are two types of communication. One, communication to the senior consultant in your hospital, okay, about this case, right? And the other one to the GP who sent the case to you in the first place. So the GP must be involved in the loop, right, of the care management plan, okay, in your patient. So don't please forget. And it will be rude because he sent you a referral letter. He wrote, "Dear colleague, please take care of this lady," right? So when you are discharging the patient, okay, you have to write back to her GP, okay, "Thank you for your referral. I have seen your patient and we discussed this and that, and this is the plan," right? Right? So please make sure that you have a good communication with your colleagues, starting from the GP. The midwife, same thing. The midwife is seeing the patient more frequently because she's in the community, right? In the primary care. And when she see the patient for the Simpson's fundal height, she have noted that the patient have a small size, okay, to the gestational age. She sent the patient to you, right? And you have arranged for her ultrasound and Doppler, and you find that she had an abnormal Doppler or whatever. So you have planned the care for this patient now. Would you please, okay, inform your consultant because the case is risky now. And don't forget writing back to the midwife, right? It will be considered as an important point, okay, to explain the care plan to the midwife. She is the person who sent the case to you, who referred the case to you. Don't neglect her, right? So please take care of this. Another point while you are applying the communication with colleague is when you have a junior colleague, right? Junior colleague maybe is doing something wrong, okay, something basic but wrong. And this came already in the exam, that you are required to teach your junior colleague about how to repair perineal tears, including the episiotomy. You asked your colleague to show you how to do the episiotomy, and he did it in a funny way, okay? Will you laugh at your colleague? Will you be angry? Will you say, "Oh, you are now ST2 or ST3. How dare you? You're not able to stitch episiotomy?" Will you say that? No, of course, will be undermining, right? So what you will do is, okay, you have to show the teaching attitude, okay? And you have to be like a good father to him, or you know, a good teacher, okay, and show support and explain nicely that we do have a better way to do this. Can I show you? Okay, or please allow me to show you how to do it in our way. Okay, so by a nice way of communication, you explained now to your colleague that what he did was wrong and this is the correct one, right? Right? So except your communication with your junior will be counted in the exam. Your communication with a consultant or mentioning about the importance of referring a case to a consultant or taking a second opinion from consultant. Referral to the people, for example, you have a case of sepsis and you didn't mention about the microbiologist. Is that good? No, you will lose a point. So you are now speaking about the management of the sepsis and the sepsis bundle, and you are explaining everything nicely with the drug doses and the fluid, blah, 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 everything. And you forgot that you take advice from the microbiologist. This can be a point minus point in the domain of communication with colleague and a minus point in applied clinical knowledge as well, right? So please take care of the point, okay? Because otherwise you are losing marks unnecessary. So people, I see people, they are putting a lot of effort, okay, to present the case or to study the case and prepare the case, and they forgot small, tiny points, but it's big marks in the exam, okay? So secure those parts, my dear, okay? Yes, it's another story, my dear. It's completely different from part one and part two, but it's very funny as well, okay? The good thing about part three, you can enjoy the practice of the part three. Okay, so I will let Dr. Amr and the next session explain to you more about the secret of communication with colleagues, okay? And with the communication also of the patient, okay? I will comment on some points, my dear friends. For the communication with patient, especially, okay, the special cases like angry patient or a patient who is receiving a bad news, a breaking bad news, you have to prepare yourself in advance, okay? Know that this station will be marked heavily on the communication, okay? So whenever you have a role player who is acting as angry patient or angry relative, okay, you have to hold your nerves and don't let your emotions speak regardless of the role player behavior, okay? Sometimes he will say something that make you angry, like, oh, you are not a good doctor. What kind of doctor you are? You don't know anything. Anything like this. Just, hold your nerves. This is all acting, okay? Okay, guys, this is all acting, and it's acting requirement for the task, and you have to respond, okay, in the nice way and in a way while you are holding your nerves and your emotions, okay, and you set everything aside and you explain, you show patience, you show understanding, okay. And my dear friends, to be honest, it's not about keeping calm and composed, that is the thing, okay? No, it's about, I'll tell you a secret, okay? Just try to show your own feeling, okay? And your own sympathy with the patient as if it's for real, okay? When you have a patient who is frustrated, for example, because his wife was waiting, for example, in the emergency uh, um, uh, room, okay, for a long time while she's in pain. And he's angry from the system and from the hospital and everything, okay? And he comes to you while he's showing this anger, okay? So just, show empathy, show understanding. If I were you, I will be the same. Or maybe I will be frustrated, okay, from the long waiting time. So at least apologize. I'm so sorry, okay, for the long waiting. But we have been today, it was extraordinarily busy. And I'm here to help you. For example, so when you are speaking like this, the role player will just vent, okay? Let them vent, let them speak, let them show their emotions and try to understand them. Another person, okay, a patient who comes with rupture of membrane at term. The recommendation does not have, anything to do, just explain to her whether you wanted to induce now or you wait. the patient will waited for 24 hours. When she came again to the hospital, they told her there is no bed to induce you. Okay, please wait. She waited. Okay, and this is made like 48 hours. And then after that, she got an infection. Baby is in the neonatal ICU because of sepsis. If you are the father of this baby, now wife have a sepsis, baby is very sick, unwell in the NICU, and now you are speaking to the doctors. Of course, you are blaming the doctors for the delay, right? Right? Okay. So show understanding to this person. I'm so sorry for what has happened. Okay. And don't take it personal. Right? So that's it. Sometimes the role player can be very angry. It's a role player, it's acting, it's nothing. Okay? Some of the candidates really told me, especially in the UK, they told me we were afraid from the role player. The role player was acting like really angry person, okay? And I thought that this is for real. What's happening? Okay, nothing. It's just an exam, it's just a role player, and you have to respond wisely. That's it. Okay? Prepare yourself also. Don't please approach this task. You're reading in front of the cubicle, right? You know that Mr. XY is waiting for you and he is frustrated or angry because his wife, right? So don't go inside and show a big smile and say, hello, how are you today? Right? No, you have to show the other face, right? That, hello, it's me, introduce yourself, doctor, this is this, and I'm one of the doctors here. Am I speaking to Mr. XY, the husband of Mrs. X, okay? Okay, yeah, so I'm really sorry to be meeting you under such circumstances, and then proceed, right? So have some, emotional intelligence, okay, to pass such a station, right? Very important that you listen to the role player in any station, especially the difficult to communication one, but in any station, I will really advise you to listen to any word that comes out from the role player, okay? And to look how their body, language is, preparing, or is they showing what is, the situation. The role player is speaking. Listen and take information, take notes if you want, okay? But show attentive listening, okay? You can say, I can see, it must be so difficult while she's telling the story, but don't interrupt her, okay? Don't say, oh my God, the 10 minutes is passing, flying away, and I wanted to her to stop speaking. I want to ask my questions and I want to explain the plan of management. Don't say that, because it's all about the role player, right? So listening, attentive listening, okay? That's very important, not interrupting the role player. Let them tell their story and respond nicely, okay, to their problem. The role player saying, I lost my aunt, okay, because she had ovarian cancer this year. And you're listening. You're not commenting, or you're saying, and how old was she when she got the cancer? And do you have any other family history? Are you a smoker? And do you drink alcohol? And you completely ignored that she lost someone in her family. You didn't even, okay, show your condolences for her. So can you think that, do you think that this is a good doctor? This is a good communication? No, this is very bad communication, right? I lost my friend, for example, or I have 3 miscarriages, okay? And I'm so worried about this pregnancy. And the doctor is keeping asking, Do you have any medical problem? Have you been, are you on any regular medication? Do you have any previous surgeries? What? We are human beings. Hey, you. Okay? Yes, correctly. So responding is very important, and this is will help you, build a rapport with the role player, and the role player will respect you. That also, a clinical examiner will give you mark, and the lay examiner, who is, as I told you, advocate for the community, okay, is sitting there, and he say, yeah, this is kind of a nice doctor. We want this nice doctor here, right? So this is how you will show the communication. Okay, guys? Communication with families, and because sometimes you have not the patient herself, maybe you will have the patient sister, you have the patient brother, husband, sorry. Okay, speaking, no problem. Okay, you can continue the station. Still, you will be tested in communication with the relative. Okay, and you are trying to show respect and show sympathy and empathy to the role player. You are trying to be quite calm, and you explain yourself, and you explain the situation, okay, while they have all the right to be frustrated, they have all the right to feel down, they have all the right to be angry, okay? So show this understanding, and if they are not happy with what you are offering them, okay, like for example, you are promising full investigation into that matter, okay, because we are taking this thing seriously in our hospital, okay, and we are going to arrange a meeting to look inside in depth of what has happened and how could that be prevented. And we are going to communicate to you, and we'll be open and honest in explaining the result of the meeting, okay? So what do you think about that? If the role player is still not happy after you said that, or you suggested another meeting with a consultant, okay, to discuss further about this topic, okay, and still the role player is not happy, okay, I want to complain, okay, so this is your right, okay, and you have to facilitate the role player to the pulse, the patient advice and liaison service. Okay, this is an office in every hospital, okay, a place where the patient can complain. So you have to help and facilitate the patient to go to the pulse and complain. So you have to say that, okay, that's your right, okay, and I'm going to help you with the contact details of the pulse and guide you. They can help you better in that matter, okay? So this is the most important point in the communication. So if the patient is sad, or she had a breaking bad news, you have to follow the the protocol of breaking bad news. If the patient is angry, you have to let the patient vent and explain herself. If the patient is speaking about her suffering from a condition, you have to show understanding, okay, of that condition, and to be sorry at least about what she's suffering, okay? And I see that this must be hard to use. Must be very difficult that you have been going through all of this, okay? So would you like to speak to somebody was a professional, okay, about that? Okay, maybe speaking out is going to help you, express your feeling. Maybe if you want to refer her to a counselor if the patient is so sad for some reason. So when you are providing help and support to the patient, you're not only fulfilling the marks in the exam, but you are having, all the respect, okay, and the love from the team who are sitting there. And believe me, they admire the doctor who is showing his humanity while dealing with the patient, okay? So that's very important domain, and that's an easy domain. Some people, they think that I'm here, okay, to show knowledge. I'm here to show the examiner that I know their guideline very well, or I have read the recent articles. So I'm going to give a perfect plan. I'm going to give second line, first line, third line, fourth line of treatment, and I'm going to explain everything. No, this is not the only thing, okay? Most important thing in the role player station, okay, that you answer the concerns of the role player and make the role player satisfied. It's like a real patient who comes to your clinic, but you have only 10 minutes to deal with this patient and give a useful consultation to her, okay? So if you are able to do that, you will pass the station. Okay, my friends? Some difficulty communication, as I told you, like communication with patient and family in a breaking bad news. And this is have a special approach, as I told you, okay? So very important that you be aware of the situation before you enter the cubicle. You understand that this situation is a breaking bad news. So avoid saying things like, hello, have a good day. How are you today? Nice to meet you. While, for example, the patient is waiting to tell her about IFD, for example, okay? So just be reasonable and read what is it, the situation, and prepare yourself for that situation, okay? And very important also to differentiate between real bad news like miscarriage, IFD, and cancer, and some concerning news, okay, with like, for example, pre-malignant lesion. Pre-malignant lesion like CIN is not a bad news, okay, but it's a concerning news. You have to follow what they are saying, okay? Uh, um, like in the breaking bad news, you have to give the patient warning shot before you mention about the news, okay, to them. So here is the spikes, okay, and the spikes is a tool to remind you. This is our college recommend that you follow the spikes for breaking bad news. Is setting up the situation, okay. So read carefully the information, understand the situation very well, keep enough time. And the breaking bad news in real life, it should be in a private setting, okay? You can also invite a friend or a relative to accompany the patient, okay? Be aware of the nonverbal cues, okay, while you're setting up the situation, okay? So this is what's called the first warning shot. The first warning shot, okay, so the patient will feel like there is something serious is going on, okay? So I can see, for example, you are here by yourself today. Would you like me to invite somebody to attend with you? That's because I have a lot of information to discuss with you. So when you're saying that, the patient will understand that there is something serious and you are now giving her the first warning shot. Then the patient perception, okay? So you might ask the patient about what is her understanding or what she, her expectations, okay? And invitation on like ask her how much you want to know. And then you go to the second warning shot and give information without delay in small chunks, pause and check response. How? Like first, as we said, okay, would you like me to invite somebody to attend with you because I have a lot of information to discuss. Okay, so Mrs. Sarah, as you know, we have done the test for the tissue, okay, or I have a piece of tissue from your womb to run a test for it. So do you have any idea about the result of it? She'll tell you, no, okay, or I have an idea, whatever. Okay, so I'm so sorry, but the result that came show that you have cancer of the womb. That's it. Okay, so you said, I'm so sorry, and then you said the news, okay, without pause in between. So first warning is the setting for the situation. Then you checked how much she knows, okay? And then you give the second warning shot. You said, I'm sorry, and you said, what is the news? And when you say the news, just to say the diagnosis, okay? Don't say, the result of the biopsy show that there is this blah, blah, blah. No. It shows that you have a cancer of the womb. And then stop, okay? Why you need to stop? You need to give pause. Pause for the role player to react, okay? Some people maybe react like in denial. Are you sure this is my result? I'm so sorry, but I have double checked and this is your result, okay? No, it can't be. I'm so sorry, but this is your result. I know it's hard for you, okay? So when you're saying that, you respond to what she's doing, okay? Or for example, she's crying, okay? If there is a tissue or something, just handle the tissue to her, okay? And wait till she's ready to speak. Sometimes they just, kept silent. So we will not spend the whole station while the patient is keeping silent. So just wait. Some people say count to 10 in your head. 1, 2, 3, 4, 5, and silence is there, okay? And then you say, I'm so sorry to be the bearer of this news. Are you ready to continue the consultation, or shall I rearrange it in another time? Why are you saying that? Because you are giving her, or you show the examiner that you're giving her time to absorb the news, right? Of course, she will not say, make it another day. We are in the exam, right? So she will say, please, doctor, continue. So what to do now? So now you start to answer and explain. Or what is this? What do I have? Which stage is this cancer? Whatever her question, you answer and respond to the patient questions, right? Show the empathy. That's very important, okay? And don't rush to finish the station in a breaking bad news, okay? The most important thing that you build the communication and you show the support and the empathy to the patient, okay? And give her an idea about what is next in her management, okay? So this is a very important aim of the station of breaking bad news. Then you summarize, okay? Summarize what is the plan of management. Give positive support, okay, to the patient. Like, for example, yeah, I know that having a cancer is not an easy thing, but with the good thing that we have discovered early, and it's known that the cancer of the womb, when it is discovered early, it have a very good cure rate, okay, and a good survival as well. So just, you are explaining truths about it, right? About the disease. And you are supporting her. Don't give her false support, okay? But you explain to her the situation, right? And give some positive support to her, okay? Give written information in the form of a patient information leaflet and a follow-up appointment, of course, okay? So will be enough for a breaking bad news station, for example, like a case of cancer. Okay, this is a written example, okay, for a breaking bad news station, like, are you here alone today? Would you like somebody to be with you? As I have quite a lot to discuss today. Then I'm afraid I don't have a good news for you. I'm so sorry, but this result that are not what we have expected to be. Okay, so this is, for example, some lines to help you, okay, find out what to say in this case. So my dear friends, I have explained to you the 5 domains of the exam, and hopefully that I have helped you, okay, and I have answered a lot of your questions or many of your queries at the beginning and the start of your preparation. A very important source of your preparation that I would like to comment on, it's the information leaflet. The patient information leaflets, my dear friends, is a very good source of the part 3 preparation. And the patient information leaflet available on the RCOG website. Okay, of course, we have a collection of the patient information leaflet. Some of them are available on the RCOG. Some topics may not be available in the RCOG website, but available in the NHS website, for example. So the patient information is a very good source to read and prepare the topic. So for example, you are preparing a topic for What? Give me examples. Okay, so give me examples. Okay, birth after cesarean section. Okay, you are preparing this topic. Okay, so you don't need to go for the guideline. The guideline is very huge, okay? And it's not going to help you in the communication with the patient or explanation by a simple language, because jargons or the medical terms are not advised in the role player station at all, okay? So what you will do is, especially when you are preparing, okay, the station, you will go through the patient information leaflet and you will open that one. Let's say this is the birth after cesarean, okay, or obesity in pregnancy, okay, having or being overweight during the pregnancy, or miscarriage, or whatever, preeclampsia, postmenopausal bleeding, PCOS, okay. So this is a lot of the patient information leaflets for the main topics of the part 3 MRCOG and your exam. What you will do is simply open the patient information leaflet for that topic, okay, and see what the information mentioned there. I will open one, for example, randomly. This is the molar pregnancy, okay? The molar pregnancy and gestational trophoblast disease, okay? Open it like this and see what the college, says about it. So about the information, okay? This patient information leaflet, this is for the patient and doctors as well. It's written, as I told you, in a non-jargon way, okay? Easy language. And what is the GTD, or the gestational trophoblastic disease, okay? This is a rare condition happen when a pregnancy does not develop normally from the very beginning, okay? So the patient want to understand a very difficult concept, okay, to clear it in easy way, how to say it. That's very important, right? So these are a group of disease or conditions that are rare, okay? And it happens when a pregnancy does not develop normally from the very beginning. So you can quit, you can have those lines and use it while you are preparing or while you are explaining to the patient, okay? So the molar pregnancy is an abnormal form of pregnancy that cannot develop into a healthy baby. Okay, let's say the patient says, how does this happen? Or why does this happen? Okay, so you can explain to her. Explanation of the molar pregnancy as it can be easy like this, okay? Answer of the patient question or the role player question, like when she asks you about what can I do to reduce this, or how can I reduce this, okay, from happening next. You will find the answer in the patient information leaflet. Now I want to explain to the patient the treatment, okay? So all of you know what is the treatment. You want to do evacuation, suction evacuation, right? How to explain suction evacuation to a patient in the exam? You will not say suction evacuation. You will say the best treatment for molar pregnancy is a small operation to remove the pregnancy tissue from the womb or the uterus. And this is not a healthy pregnancy. This operation is usually done under general anesthesia or while you are asleep, okay? And this involves a small suction tubing to remove the abnormal pregnancy tissue. This tissue will be sent to the lab to confirm the diagnosis of molar pregnancy. So now you have explained to her the management plan, including the suction evacuation, and you have explained to her that you are going to send it to the histopathology in a simple way, right? Now I want to tell her that there is risk of developing abnormal, GTN. Okay, so it's important to be sure that if you have a molar pregnancy, that there is a small risk that you have some abnormal pregnancy cells may develop in more severe form of that disease. Okay, that's mean that you may need further treatment, and that's mean also you have to have a follow-up plan. This follow-up plan will be provided, okay, by a specialist center, okay, so the treatment can be coordinated and provided by expert in this field. These centers are hospitals in London, Sheffield, and Dundee, okay? So follow-up involves measuring the pregnancy hormone, which is the HCG, either in your blood or in the urine, until it returns to the normal. The special center will post you the kit that you need, and you will have to have your blood test done at the GP, okay, or local hospital, okay? So we will provide you with a little information, okay, about the hormone level. If the hormone level is falling, okay, so that's mean the number of the abnormal cells is also falling, and you probably won't need any more treatment, okay? So she will ask you another question about how long shall I receive the follow-up? How long you will receive the follow-up will depend on your individual situation, and whenever you have had the molar pregnancy, okay, we have to follow the hormone level till it become normal, okay? So she will maybe ask you, when can I be pregnant again? Okay, right? So you will find even the answer here, okay? So the answer, when can I be pregnant again? Okay, the molar pregnancy is not going to affect the chance of having another baby. However, after a molar pregnancy, you should avoid pregnancy until the follow-up program is complete. Okay, so you are explaining in an easy way. But otherwise, if you haven't read this patient information leaflet for such topic like a molar pregnancy, which is difficult to explain, okay, you may find the explanation of a molar pregnancy in a simple language tricky to the role player, okay? So I would advise you, for example, that you go through the patient information leaflets, especially at the beginning of your preparation. Okay, guys? Any further questions, please? I know there is a lot of points to be covered, okay? And there is questions from my colleagues that I would like to help and give you my advice regarding this. And one question that I have received, which is very important, it was about the period of preparation. Look, guys, to be honest, okay? I'm very honest in that. People can pass this exam in like 3 months of preparation, right? Some people, they might take 6 months or more for the preparation. We have successful examples, people who pass the exam, mashallah, in January, okay, 2024, and passed part 3 in May 2024. We have examples passed their part 2 exam in January 2023 and passed their exam in May, okay? And also people passed their part 2 in July and cleared their part 3 in November. But it will all depend on how much time do you have for study, because it's different from a person to another. Okay, so if you have availability of time, okay, for practice, that's will be very good for you. Okay, so you can focus on the exam and you focus on the preparation and the practice every day till the exam. So it's a good point. Okay, some people they have already experience with other exams. Okay, especially exams like MRCPI or exams like the PLAB, for example, in the UK. So when people have experience of other exam, that's make their job more easy, okay, or a bit easy for preparation. Some other people are busy. They have work commitment, they have family commitment. So for them, I would say, okay, just to prepare yourself, take your time, no problem. Nobody is running after you, right? So you will look into your own circumstances. You will look to your own individual, okay, study plan. If you do have the time, go for May, okay. If you have the time, go for November, no problem, okay, after your part 2 exam, there's no problem, okay. So I need more time for preparation. I have a busy schedule. I have children, anything, okay? Okay, it's fine. Prepare for the next May, okay? Nobody is running after you. And don't appear in the exam unless you are ready, simply, okay? Another factor that's very important in your preparation, not only about the time, it's about the study partner, okay? Having a study partner, my dear friends, is very important for this exam. Why? Because you're not going to study notes, okay? In this exam, I will advise you not to study notes. I will advise you to study with a person, okay? So having a study partner can make your job easy in studying. You can have a study group as well. So every one of you now should search about the study partner or about maybe a practice group, okay? You guys can have like 2 hours of study per day or 3 hours even, okay, of study per day, where you have topics to cover, certain topics, the certain task, and I will advise you to start with books, as I said, okay? And you practice, and after you practice, read from the books. One time you are the role player, read the role player brief and be the role player. Excuse me. One time you be the candidate, okay? And that will be good and beneficial for all of you. And this is the example of books, okay, that we advise to start with. The Lisa book, as I told you, is a very important. Some people consider it as the Bible for the Part 3 exam, okay? And I say that this is a very important step to start. I will also advise you to watch some tasks from the circuit of the RCOG circuit. Okay, it's very useful and it's very real, simulation of the exam. Even with the same examiners, same people who put your exam, they are there in the circuit. And very important that you not only watch the videos, but listen as well to the feedback of the examiner. That will help you understand how the marking of the exam is done. Next book to practice is the useful book is the Oxford book. And the Oxford book is very important book for practice, okay, while it's divided into module-wise. So in your study, let's say you have the module of early pregnancy. After you have the module, practice the cases of the early pregnancy module from the Oxford book, okay? So you will have to, cover, okay? Now you will have a good covering, okay, of the tasks in the module-wise base. Then you can go to books that have that have circuits at the end, okay? But at the beginning, you start with the task with the module-wise. Now I need to show you an example of practice, because also this was a request from your colleagues. One of my dear friends in the group, she was asking how to do the task and feedback, right, in the daily practice of the group. So guys, what we would do is simply here, this is an example of one of the groups, okay? So here, the task will be posted, okay? And let's open the task here, for example. This is one task from the surgery and post-operative module, okay? So the task is written here to you, okay? And here is the requirement of the task. Then here is the instruction to the role player. What your job, my dear friends, is simply, okay, you will go through the task, read it well, okay, and you will, after you read the task very well, okay, you will practice, you and your study partner, or sometimes people practice with themselves, okay, according to your own convenience time. Then after that, okay, you are going to post, okay, the recording for the task. Okay, of course, we provide you with all necessary document required for the preparation. Okay, so when you go through the task and you record it yourself, okay, for example, here, this is one of the recording, okay, this is one of the recording, okay, so the mentors are listening to the recording, okay, and then they give the structured feedback. The feedback is like this, okay, so this is a structured feedback for the task. Can you see it, my dear friends? Is it seen on the screen? The structured feedback, my friends, is for the module-wise and domains that mean tested in the task. Information gathering, what should have been expected, and what the candidate have done. Communication with the patient, what have been expected, okay, and what the candidate have done, what is the advice to the candidate. Patient safety, what have done, okay, assess the main concern and all, okay, and advice to the patient to cover better. Communication with colleague, here, okay, what should be covered in the communication with colleague, and it's covered by the candidate. Applied clinical knowledge and the same, okay? So guys, for everyone is receiving the correction of their task, correction of their performance, okay? So they will be aware every time, okay, with the marking scheme, and every time what they have missed in the preparation, okay, and what they can do to improve themselves in the next time, okay? So this is a kind of a feedback, okay? As I told you, it's a structured feedback. So this will be your daily job, okay? Daily job that you have to study the task required, okay? And then send your recording, then you will receive the correction of the task. The correction of the task, as I told you, it will be like a marking sheet like this, okay? According to each domain, and you will see what you have covered in that domain and what you have missed and what is advices for the next. Okay? Guys, I'm sorry. Can you see it on the screen? Can you see example of the correction? Feedback. Okay, yeah, okay, so seen, well done. Okay, brilliant. Okay, guys, so this is how we can give you a feedback. Sometimes we give a voice note, okay, for a feedback to explain, you know, the task, or to give a comment to the candidate to the task. But the written one was a good idea. And to be honest, this is Dr. Madinji idea, okay, that to give like the exam one, okay, like the exam exactly in a domain-wise every day. So the candidate will see their progress and they can benefit, okay, from comparing their behavior, their performance over the days. Okay. How many times on Zoom? Okay, times on Zoom usually will be 1 or 2 times per week, okay? But the practice stations is every day. So the homework task is every day, okay? Only 1 day on the week off, which is the same day of the main module in the Zoom, okay? Because people will attend the live session and they will prepare themselves. Next day, they will start the preparation of this module and apply what they have learned. Okay, guys? Any questions so far, my friends? I would like to thank you very much for attending the session today, and keep on activity. If you do have any question, if you do have any query, if you do have any difficulty in your preparation for the part 3, please send it to me. I will explain it, and I'll be happy to guide you guys at the beginning. And after that, you will be expert, okay, in the part 3. The part 3 is just a fun to go through. Believe me, it's a fun, okay? If you take it as a fun, and if you understand the principles of the marking and the principles of the exam at the beginning, okay, so you will master the part 3 and you can go to the exam very confidently. Hopefully all of you will celebrate their success very soon. People who are appearing in November and my friends who are appearing in May. Good luck, everyone, and see you in the next meeting. Thank you.